morning. I'm Sarah Tanner, and I have some exciting news for the 1 in 10 Americans living with food allergies. Omalizumab, or Xolair, which has been used for about 2 decades for the treatment of allergic asthma, recently received FDA approval for the treatment of food allergies, specifically for type 1 reactions like anaphylaxis. It's the first option for children as young as 1 year and for adults. And it's the only option to treat multiple food allergies with one medication. Omalizumab has been studied for patients with allergies to peanut, eggs, wheat, milk, and tree nuts, such as cashews, walnut, and hazelnut. Omalizumab is a monoclonal anti-IgE antibody and works by raising the threshold that triggers an allergic reaction. This can help to protect patients from accidental exposures and may make reactions less severe. But patients will still need to practice allergen avoidance and carry epinephrine injections at all times. This is not a cure, and it won't stop an allergic reaction already in progress. But it may give allergy sufferers peace of mind for eating out or other scenarios where cross-contact exposures are a possibility. Patients will need doses every 2 to 4 weeks, with doses depending on their baseline IgE level as well as weight. It's not yet known if therapy needs to be lifelong or if effects will persist after discontinuation, and studies are ongoing. Omalizumab carries a box warning for anaphylaxis, but the overall rate is actually really low, at only 0.09%. Its adverse effect profile in the Outmatch trial, which garnered it this approval, was similar to placebo, except for an increased number of injection site reactions in the omalizumab arm. Reassure patients that omalizumab has not been found to be associated with an increased risk for malignancy. Omalizumab is an injectable specialty med and pricey. It's also unclear if insurances will cover this for patients with only one food allergen, although it's been approved for use in patients with one or more food allergens. The estimated monthly cost ranges from $2,900 to $5,000, depending on dose. But copay programs are available and can help patients afford this therapy. The only other approved treatment for food allergy is Palforzia, which is peanut allergen powder. Palforzia is oral immunotherapy and approved for children ages 4 through 17 years. It's given in increasing doses for at least 5 months, but it may take longer to achieve the full dose, depending on how patients respond to the uptitrations and what types of allergic reactions they experience. Palforzia also is not a cure, but may reduce reaction severity for accidental exposures. Patients cannot eat peanuts freely and must carry epinephrine injections with them at all times. It's very important not to miss doses, since this is a desensitization protocol, and patients will need to visit their provider frequently to initiate and escalate doses, which may be challenging for some kids and their families. Palforzia also has a box warning for anaphylaxis, but unlike omalizumab, it requires a REMS due to higher use of epinephrine than allergy avoidance alone. Anaphylaxis rates are 100-fold higher than seen with omalizumab. Ensure patients and their families are well educated on signs and symptoms as well as the treatment of anaphylaxis. Palforzia is also a specialty med and costly, but has copay programs. Inform patients more options are on the horizon. Studies are ongoing for other treatment forms that may improve adherence, especially in kids, like patch immunotherapy. Early trials in toddlers aged 1 through 3 have shown promise with a patch applied between the shoulder blades. And there are additional studies looking at omalizumab plus oral immunotherapy, so stay tuned for more options.